Kidney disease related to diabetes has increased greatly over the past few decades, and this is related, in fact, to the epidemic of diabetes that we're seeing worldwide. So what we know is that between 20 and 40% of patients with diabetes get diabetic kidney disease, or DKD, also sometimes called diabetic nephropathy. And as there are more and more patients globally with diabetes, currently the IDF estimate is about 387 million patients with diabetes today, and that number is only getting larger. With that, you can imagine how the number of patients with diabetic kidney disease is also growing at the same pace. Diabetes leads to kidney disease through mechanisms having to do with high glucose and also high blood pressure. We know that in type 2 diabetes, about 70% of patients have hypertension or high blood pressure. And both of these things, the high glucose and the high blood pressure, lead to a process of damage within the kidneys and diabetic kidney disease. Now, with diabetic kidney disease comes hypertension or more high blood pressure, so there is actually a vicious cycle where with increasing blood pressure and with the increased blood sugar of diabetes, the kidney disease worsens over time. Why precisely some patients get diabetic kidney disease and others don't is not well understood. It's an area of very active research. Again, we know that the majority of patients with diabetes don't get it, but a very large minority, 20 to 40% of patients with diabetes, do get diabetic kidney disease. What we do realize related to who's going to get diabetic kidney disease and how it's going to progress is the control of the risk factors of blood sugar and blood pressure. So we know that if a patient's blood sugar is well controlled, the risk of getting diabetic kidney disease decreases. And we know if their blood pressure is well controlled, the risk of getting kidney disease in general is decreased. Certainly the treatment options for diabetic kidney disease are centered around control of blood sugar and blood pressure. We know that tight blood sugar control is very important to prevent diabetic kidney disease and to prevent the progression of diabetic kidney disease. And we know that good blood pressure control is also very important for preventing kidney disease and preventing its progression. On top of these two basic facets of the treatment of diabetic kidney disease is the importance of treatment with angiotensin receptor blockers or ACE inhibitors, the two classes of drugs that interact with the renin-angiotensin system that have been shown to help protect the diabetic kidney. And these are also drugs that lower blood pressure, so they're sort of a treatment of choice for high blood pressure in patients with diabetes. Aside from those treatments, it's also very important in patients with diabetic kidney disease to control their risk factors for heart disease. And the reason I say this is that patients with diabetic kidney disease have a very, very high rate of heart disease, heart attacks, strokes, cardiovascular death. So at the same time that one is treating the diabetic kidney disease, it's very important to also treat the risk factors for cardiovascular disease, such as high cholesterol. Treatment for diabetic kidney disease, both in the prevention of it and in preventing the progression of it, is successful in the sense that you can have a major reduction in the incidence and progression of diabetic kidney disease with good blood sugar control, good blood pressure control, and ACE inhibitor or ARB therapy. It's unsuccessful in the sense that despite the presence of these therapies, we still have a sizable proportion of patients with diabetes getting diabetic kidney disease, and that kidney disease progressing such that diabetes is the #1 cause of chronic kidney disease in the United States and worldwide, and it is also the #1 cause of end-stage renal disease, that is, kidney disease that's progressed to the point of needing dialysis or transplantation. So there's still a huge unmet medical need despite the efficacy of the current therapies.